Tell yourself today is gonna be the best day of my life and I am going to make the most of it. And this is actually not too bad. Wow, this is actually doable. And when you are done with the day, tell yourself, great job, you did amazing. Assalamu alaikum. Hi everybody, welcome back to another Saturday. If you are new to the family, welcome. If you're already subscribed, thank you guys. Today we are going to talk about rotations. For those of you who don't know what a rotation is, it's basically the second part of a medical program. I am a PA. Obviously you guys already know this. So it's not only for PA school, it's for medical school, nursing school, and I think any type of medical program will have a didactic, which is a classroom portion of the program, and then the rotation, which is where you actually go and see real patients, and you go to a hospital or an outpatient clinic, a rehab center, and you actually work with a real patient. You get to be a provider or a nurse or whatever you're trying to be, but it can be so exciting because you're actually doing what you want to do, but it can also be so scary. So today I'm going to give you guys tips on how to have fun and also a fruitful rotation. So keep watching the video. I am actually going to start with how do you prepare for a rotation, right? So you're in class, you're settled in, and then suddenly class ends and you have to go to a different location, for example. It may be another state, it may be within the state, but you have to move from your home and settle in another place. So how do you prepare for that? I'm sure every school has their own way. So I'll share with you guys how my school did it, and then maybe you guys, if your system is not the same as ours, maybe you can take some of the tips and apply it for yourself. In my school, for my PA program, we did, I think, 8 rotations, and then 2 of them were electives. Let me just confirm that. So we did family medicine rotation, we did surgery. So the required ones were family medicine, internal medicine, surgery, OBGYN or women's health, pediatrics, and then you could choose 2 electives. I think other schools have 1 elective, some schools have 3 electives. So every school is different in terms of how many electives that you can do, but your electives are basically this. For ours at least, it was 6 weeks. All of our rotations were 6 weeks, so our electives were also 6 weeks. That meant for some people, aka people like me, you had to move for every rotation, right? For me, I did my first rotation, which was family medicine. I did it in Hoopa, which is a Native American reservation in Northern California. And then my second one was vascular surgery, which was an elective, and I did it in San Jose. Third one, I flew to Seattle for internal medicine. And then I flew to Las Vegas for OBGYN. And then I moved back to California, Bakersfield for my orthopedic surgery. And then I went to San Diego for family medicine, and then I went back to Bakersfield for emergency medicine, and then I went back to San Diego for family medicine. So as you can see, even talking about it is exhausting. Now imagine you have 6 weeks for each of those rotations, and you have a weekend to basically move from one location, move to another location, get settled in, and get ready for the next rotation. So it can be really exhausting and really tiring. So what can you do to help yourself make that process fun is basically essentially the first part of this video. What I did, or what some of my classmates and like the system that kind of was in place for my school, is to find a housing. The class above us, like every rotation that we did, somebody from our class, the class above us has done it. So the class above us made like list of housing in that area, and names and people's contacts. So if you were placed in that rotation, you could contact that person and see if they have a housing available to rent, like a room in somebody's house or an apartment to share with somebody. So that's like how we found housing. And then if you're going to a place where you have family members, obviously you're going to stay with your family. If you have a place with friends, you stay with your friends. And then some of my classmates were staying with like their friend's cousin or their friend's sibling. So that's like at least how with me and the people that I knew, how they found housing. For your school, I would say if you are, first year PA student and you're just wondering about how do I find housing, talk to the class above you and see what they're doing. Talk to your program director or your, the rotation coordinator and ask them like, how did people find housing and how do I go about it? So now you found housing, now what do? You're moving to a totally strange place. You don't know anybody, you don't have any friends there, you don't have any family members there. So one thing I can tell you about rotation is at times it can get really lonely and really depressing, I would say, in a way, especially if you're somebody that's so close to their friends or their family members and you're just used to being in a social place. So suddenly you're by yourself. So how do you get past that and actually enjoy where you're at, right? So for me, what I did was I made coffee shops like my thing. That would be the same no matter where I go. So some places, like when I was in Hoopa, there was no coffee shop, so I just made friends from work, and that was like an exception. But for most places, you can find like Starbucks, or you can find Phil's coffee shop, or like any coffee shop. It doesn't matter where it is, but if you have like one thing that no matter where you go, you're able to find that thing there, I think that helps so much. So I study at coffee shops a lot. So no matter where I went, the first thing I would do is I would find the nearest coffee shop to me and I'll just go there and I'll study there. So that was like familiar thing. Even if I didn't know anybody, even if I had never been to that place, I knew that I could find a coffee shop. And it may sound so simple and like not a big thing, but it really does make a big difference in your mental health. If you know that, okay, it doesn't matter where I go, I know I can always find a coffee shop to study at. The other thing is libraries. Like you can go to a library. Regardless of where you are at, you can go to a library. You can find a table at the library, and that can be your comfort place to study until you get to know people at the hospital or the clinic, your neighbors. Until you make friends, at least you can go to the library and study there. What else can you do? If you have like a drink, honestly, it's like the little things that make such a big difference. If you have a favorite drink, when you go to a new place, look for that drink. If it's boba, if it's just water, just knowing that no matter where I go, I can find that drink, and that just makes such a big difference. Don't take it lightly, or don't think it's something small. It's really the little things are what make your mental health stronger, I would say. So now you've found your place and you have found your comfort thing. Preparing for the actual rotation itself, I would say first impression is very important. So when you are going to your first rotation, make sure you have your white coat ready, you have your stethoscope, a notebook and a pen is a must. Do not go to your first rotation or any other rotation, your subsequent rotations, all of them, have a notebook and a pen so that you can write down things. Make sure you're well put together, you present yourself in a professional way. Always show up ahead of time. If you are told to be at the hospital, for example, at 6 a.m., get there at 5:30. If you're supposed to be there at 8 a.m., get there at 7:30. So don't be late. You don't want the first impression to be, oh, that student is already late, and that just follows you throughout the whole rotation. You want your reputation to be very strong. Essentially, you're treating every rotation as a job interview, like a potential place that you could work. So prepare yourself accordingly. Prepare yourself as if you're going to an interview. So that is, the initial things. You moved in, you're settled in, you found your study place, you're prepared. Then you show up to the rotation itself. Make sure you're smiling, make sure you're friendly, make sure you're welcoming. Don't be grumpy and whining the whole time you're there. Enjoy it. You're gonna be there for 4 to 6 weeks. Might as well make the most of it. Treat every rotation as if it's your favorite rotation. Honestly, even if you don't like it, you can trick your brain into thinking it's your favorite rotation. Like, enjoy the little things, the long days, the long hours, the hard patients, the long surgery, whatever it is. Tell yourself, today is gonna be the best day of my life and I am going to make the most of it. And this is actually not too bad. Wow, this is actually doable. And when you are done with the day, tell yourself, great job, you did amazing today. Like, compliment yourself. No one else is gonna be there to compliment you, or no one is gonna tell you you did good. By the way, in rotations, no one is really gonna tell you you did a great job. Some preceptors are really nice and really cool, and they will cheer you up along the way, and they're so proud of every little thing that you do. Some preceptors are going to expect a lot from you, and they can be harsh at times. They can, you know, they will give it to you as it is. So don't take anything personal. It has nothing to do with you. You're there to learn. You will make mistakes. It's fine. It's just part of the process. So how do you impress your preceptor besides, you know, showing up early and being friendly? That's expected in any place. You're gonna show up on time and you're going to be friendly. So other than that, what can you do to actually impress your preceptor? I would say having a notebook and a pen, like a small pocketbook, is the first thing. They would, like, when he tells you something or he says something that you know you will forget, which is, by the way, very easy to forget when you're getting so much information coming at you at once. Having that notebook and writing things will show them that, you know what, this person is really serious, and they actually do want to learn. That's why they're taking notes, right? You don't want to be that person that says, oh, I'll remember, and you will not remember. Trust me, you won't. So write it down. Unless you're that one person that just remembers everything, it's so hard to remember everything. So just write it down, have your note. The second thing is you will get pimped, meaning you will get asked questions, random questions. A lot of my rotations, I got pimped a lot, and actually those are the ones that I enjoyed the most, because I am the type of person, if you tell me something, it's easy for me to forget, but if you ask me a question and you make me work for the answer and like actually make my brain think, I'll remember that more. So I actually appreciate it, and I love the rotations where I got pimped a lot. So when you get asked question, if you know the answer, you know the answer, great. If you don't know the answer, don't just be quiet and like say I don't know or I'm not sure or any of that. So what you do is you just throw an answer out there. Whatever you're thinking, just say it, because sometimes what happens is you actually don't know the answer, but you're nervous and you think it's wrong and you won't say it, and then the preceptor will tell you exactly what you're thinking, and then you go like, dang it, I wish I had said that. I would have seemed cool. So just say what you're thinking. It doesn't matter if it's wrong. If it's wrong, they'll just tell you what it is. What people don't like is they ask you a question and you're just staring at them, or you just say, I don't know, and you don't even try. So try your best and say whatever that comes to mind. If you said something wrong and they correct you, write it down, go home and study that part. Because in some rotation, things come back again, and what you don't want is you get asked the same question again and you don't know again. That can look really bad on your side. So stay ahead of the game, guys. Stay ahead of the game. Study, go home, study, 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 so that next time somebody else asks you that question or the preceptor asks you again, you're ahead of it. The next thing is, if you don't know something, ask question. No question is too small or too dumb. Like, a lot of people will think, oh my god, this is such a silly question, I should not ask. But honestly, if you don't ask, how else are you gonna know? And preceptors, they are there to teach you. These are the people that took you in. These people are people that said, you know what, I want to help students and I want to teach them, so send me your students. So they expect that you would ask them questions and they won't shut you down. So if you have any question, ask them, regardless of how small it is. If you are afraid to ask your preceptor and you feel like, you know, your preceptor is intimidating and you would rather not ask them questions that you think are simple, in reality they may not be simple, but you perceive it as a simple question, you can ask other providers in that hospital, you know, that you work with, or other PAs or MPs or whoever that's there, just to get that question. But don't go home with a question in your mind. Another thing is imaging, right? So you can ask your preceptors to teach you how to interpret imaging. If you do, for example, say like ER, in ER you can get a lot of x-rays and CT and MRI. Tell your preceptor, like, whenever you guys are, you know, done with the shift, like 5 minutes to go over imaging with you. Remember, you're always going to show up early to your rotation. So Some preceptors are also there early, so you can ask them questions at that time. You can ask them to teach you images at that time. You can ask them to explain labs to you at that time. That's like a perfect little one-on-one session, especially because you may get really busy during the clinic hours and you may not get a chance to actually pause and ask a question. Going with that is, if you have a burning question and your preceptor is really busy with the patient, don't jump in and be like, hey, can you tell me this? No, write down your question so you don't forget and ask later. You don't want to interrupt them and basically interrupt the train of thought as they're trying to give care to that patient. That is always a priority, right? What else? So that is basically how you impress your preceptor. Next, how do you actually prepare for that rotation itself? Like, what can you do to actually help you in that rotation to make you seem prepared? So for some rotations, your program will give you, well, at least my program, they give us objectives to learn for each rotation. So for ER, we had ER objectives. For family medicine, we had family medicine objectives. And my classmates and I, we split the questions or the topics and we answered them, and then we just brought it all together and we had one big document that we studied off of. Sometimes we ask the class ahead of us to share their objective with us. So whatever it takes to get that material, whether it's you doing it by yourself, you and your classmates sharing, splitting the topics and doing it together, or whether somebody else does it and then they share their note with you, whatever it is, study those topics that you're given for the rotation itself. And then like some common things that you can look up and study ahead of time is, for example, if you're going to family medicine, right, you can study hypertension, diabetes, how to do wellness exam. If you are going into, say, urgent care, like knowing the acute things like acute otitis media or like otitis externa, or fractures, or headaches and things that show up at the urgent care, common things. Studying ahead and taking notes and making yourself a little reminder notes. For surgery, if you're going to surgery, you can YouTube common surgeries that are done in that particular subspecialty. Like, for example, if you're going into orthopedics, you can watch surgery on fractures or knee replacement or total hip replacement. Suturing, you practice your suturing if you're going to rotation. That is surgery, because you're going to be doing a lot of suturing, right? Different types of suturing. You may get pimped on like dissolvable sutures versus non-dissolvable sutures. So knowing, what are the common things that happen in this rotation and studying ahead of it can help you prepare for that rotation itself. Again, your little notebooks, you're gonna have all your little notes on there. You're gonna have your questions on that notebook, and you can, ask questions if you do have them. You ask your preceptors. For rotations, honestly, I did not use a whole lot of books. I used, the PANS Prep Pearl to study for different sections. And then the only books that I actually bought were the EMRA Antibiotic Pocket Guide for ER, and also EMRA ER Pocket Guide. So only ER is the one that I actually bought, like actual textbooks. For the other rotations, I was able to, get by my notes, the PANS Prep Pearls, and Roche. Roche is like a must. Like, I did a lot of Roche questions, and it will help you prepare for your boards too, right, for PA school. So doing Roche questions, maybe 20 a day, or at the beginning you can start by doing 10 a day, but at least like averaging 20 to 30 per day will help you not only succeed in your rotations and end of rotation exams, but it will also help prepare you for the boards, because once you're done with the rotations and you pass your end of rotations exams, the last thing you will do is your board exam. So basically, when you're on your rotation, you can also not pretend, you should be preparing for your board as well. For me, like, I took my board exam a week after my last final exam for PA school, which is, we finished our rotation, we had like 1 month of classwork, and then we took our finals, and then a week later I took my board. So lots of Roche questions. Again, for rotation, studying besides your objectives and the notes from class and the things that you learn on the rotation, the questions that you asked. Extra resources that I used were the pants prep pearls, and then the rush questions. So that is how you prepare for the rotation itself, and then how you study for your end of rotation exams. So basically, you know, those are the tips that can help you get ready for your rotation, impress your preceptor, and prepare for your end of rotation exams. The other thing is, honestly, really have fun. Like, I cannot emphasize on how much fun you should have. Every week, at least one day, go out with your friends, go hiking, go do whatever fun things that you like to do, because rotation should be a time where you actually get to see patients and you enjoy yourself, because you're actually doing what you wanted to do. You're not sitting in class anymore. You're at the hospital. Like, you should be happy waking up in the morning, going to sleep early, studying. I know I'm speaking like a true nerd right now, but honestly, it should be so much fun. I enjoyed rotation, and I don't see any reason why you shouldn't either. The only things that I can see, you know, people having trouble with are people that are shy, and it's just like they have to get out of their element and be out there and like be social and be friendly. So I can see how that can be difficult for you, but fake it till you make it. Seriously, people don't know you. Every rotation is a chance to prove yourself that you can be whoever you want to be. If you're an introvert, honestly, practice being outroverted. What is it? Extrovert. Practice being an extrovert. If you feel like, this rotation is not my best, that's okay. Guess what? You're going on to the next one, and it's time for you to reinvent yourself again. There, you can honestly restart as many times as possible. So don't feel like, I did so bad in the first rotation, what makes me think that I can do better in the next rotation? Well, A, you're not at that rotation anymore. You're in a whole new place with new people, so you can be whoever you want to be again. Just be kind and be true to yourself the whole time, and be prepared. My final thoughts on rotations are, seriously, again, just have fun and make the most of it. You guys are gonna do so good. If you are doing your rotations right now, comment down below, let me know how it's going. I would love to hear about it. If you are getting ready for rotation now and you have a question that I haven't spoken in this video, go ahead and comment below. I promise I'll get back to you and, you know, share with you whatever information that I have. It's always a pleasure recording this video for you guys and sharing it with you. I've been hearing from a lot of you guys. Seriously, thank you for all the feedback, thank you for all the love, and I am so glad that you guys are actually, you know, benefiting from these videos, and I look forward to making more videos and sharing with you guys everything that I have learned in my journey. Thank you. Bye.